Today we will learn ankylosing spondylitis. Ankylosing spondylitis. Sometimes it is also known as bamboo spine. Bamboo spine. So what is ankylosing spondylitis? It is a chronic inflammatory arthritis which affects two joints mainly: sacroiliac joints, and sometimes whole spine. So primary site of affection is sacroiliac joints, and later on it progresses and now it affects whole spine. So now what is the clinical feature of ankylosing spondylitis? As the name suggests, ankylosing means Ankylosed means immobility of joints. Immobility of joints, basically sacroiliac joints, due to fusion of joints. So fusion of joints is very important factor in production of ankylosing spondylitis, and joints mainly affected are sacroiliac and sometimes whole spine is affected. Now come to next point. Recurrent episode of low back pain. Because its onset is insidious. So low back pain with insidious onset. This is also important thing about its onset. Third is morning stiffness of affected joints. And the interesting point is that symptoms worse in morning and relieved by motion. Worse in morning and relieved by motion. This is characteristic feature. And it also causes difficulty in breathing when costovertebral joints involves. So difficulty in breathing, and mainly difficulty occurs during expansion of chest. Breathing difficulty. Due to involvement of costovertebral joints. And its progression is ascending type. Ascending progression along the spine. Ascending progression along the spine. These are the clinical feature of ankylosing spondylitis. Now come to investigations. Thoracolumbar spine X-ray. Thoracolumbar lumbar spine X-ray. And we can clearly see sacroiliitis in X-ray, widening of joint space, and one bony growth is seen which is known as syndesmophytes. Syndesmophytes appear symmetrically or symmetrical syndesmophytes appear in X-ray of that affected part, and this syndesmophyte is pathologically similar to osteophyte, and it originates from tendon or ligament which is present inside spine. So syndesmophytes and osteophytes are pathologically similar, only origin point is different. So this is about syndesmophytes appearance in case of X-ray, and this investigation confirms the case of ankylosing spondylitis in affected joints. Now next point is management. How can we manage the case of ankylosing spondylitis? So management. Its management requires relief from pain, Second is its restriction of movement becomes reduced. So we can increase the range of skeletal motility by any means. This is the objective of management. Increased range of skeletal motility, because restriction of movement is also an important symptom of ankylosing spondylitis. So we can increase the range of skeletal motility. This also be the objective of management. Regular exercise, and swimming is an ideal exercise. Swimming is an ideal exercise to improve the case of ankylosing spondylitis. Physical activity is a cornerstone of management. Appropriate physical activity. Appropriate physical activity is cornerstone of management. Next, as far as treatment is concerned, NSAIDs and corticosteroid is effective treatment and safe treatment. So this is all about ankylosing spondylitis. And in clinical feature, we can also see the rigidity of spine, ankylosed spine, restriction of movement in lumbar spine. So these become the all clinical features about ankylosing spondylitis. Investigation, you can see X-ray of spine, thoracolumbar spine X-ray, and about the management and treatment. So this is clear. In next topic, I will discuss osteoporosis.